Hi and welcome to Lessons from the Grand Rounds. In this short video, we are going to discuss about the mechanism of synergy for a flag-based chemotherapy regimen. So what exactly is flag? When do we use flag? So flag is basically fludarabine, aracin or cytarabine and a GCSF-based chemotherapy protocol. Usually it is an intensive protocol for young fit AML patients. So the protocol is deliberately built on a biochemical and a biological priming mechanism with one action to activate more and more of cytarabine. So let's see how it works. So for example, when I plan for a protocol for this protocol at 6 a.m. in the morning, I give the patient a GCSF. So what is the mechanism of GCSF here is no cytotoxic mechanism. There are two mechanisms here, and what are the two benefits? The first benefit is that the leukemic cells which are there of AML, they are driven from the quiescent or G0 phase to the S phase, first thing. So it drives the leukemic blast into the S phase. So what is the mechanism of driving, what is the main motive of driving into the S phase, we'll come to see. So it has driven the leukemic blast into S phase. The other thing is we are giving it regularly daily so that there is a speedy recovery of the neutrophil post chemotherapy. So these are the two mechanisms of GCSF, which is given at 6 a.m. At 10 a.m. in the morning you give fludarabine. So what is the action of fludarabine now? So fludarabine is a purine analog. Fludarabine, the main action is to cause chain termination. So how does it cause chain termination? So it basically incorporates into the leukemic blast DNA, and it causes chain termination, and it also inhibits the DNA polymerase enzyme, which further inhibits the DNA repair pathway. And the other additional mechanism of fludarabine is to activate or upregulate the enzyme deoxycytidine kinase. And so upregulation of this deoxycytidine kinase actually activates more and more of cytarabine. So now the cytarabine is given at 2 p.m., which is 4 hours apart. So before the cytarabine is given, all the cells are driven into the S phase by GCSF. The activity or the action is catalyzed by fludarabine. So eventually cytarabine, the leukemic blast cells are sensitive to cytarabine specifically in the S phase. So we bring a lot of leukemic blast in the S phase, which targets the killing by the cytarabine. And the other thing is it is upregulated by fludarabine as a synergistic mechanism. So this is the mechanism of um, flag-based chemotherapy, where the leukemic blasts are driven into the S phase by GCSF, which also helps in the post-chemotherapy neutrophil recovery. And the second thing is fludarabine. Apart from causing chain termination, similarly, it also increases the deoxycytidine kinase, which more further activates the cytarabine and furthermore catalyzes the efficacy and the action of cytarabine. So this is the mechanism of flag-based regimen. We commonly use FLAG-WIN or FLAG-IDA. So FLAG-WIN is most commonly used. So this is basically the mechanism of synergy of flag-based chemotherapy. Thank you.